Our guest today is Dr. Kamal. Dr. Carr pioneered the development of CLTS, or Community-Led Total Sanitation, in Bangladesh in 1999. CLTS is a policy intervention designed to trigger an increase in household demand for improved sanitation by triggering disgust and shame at open defecation practices. And since 1999, CLTS has been rolled out in dozens of countries around the world. And most international donors have adopted CLTS in some form in their own programs. So, Kamal, it's a great pleasure to have you here today in the Lee Kuan Yew School. It's a great
No, it's a great pleasure to come here in Lee Kuan School.
Yeah. So let me start with a question about how you came up with this idea. I mean, it's quite an innovation, right? I mean, it was very, very different than what was going on in the sector at the time. How did it happen? Was it something that developed over a long period of time, or did you have a flash of inspiration?
Yeah, in fact, it's the question was, I mean, it's definitely, it's a, I mean, it's a huge paradigm shift, what has happened. But as you asked me that, how did it happen? In fact, it happened sometime in, 1999 and early 2000. I was involved in evaluation of water aid in their country program in Bangladesh. And I was the team leader for the evaluation. And I went to see a traditional, this water and sanitation program where latrines were built with subsidy and construction materials and design and everything were given to the people, and water facilities created. And in my team, I had many specialists, and different specialists, the hygiene, education specialists, engineers, and all that. But, in villages, we visited almost everywhere in Bangladesh, from north to south in different parts of Bangladesh. We saw the toilets were built, the local NGO partner of Water Aid, VERC, Village Education Resource Center. They did a good job. But the toilets were there, at the same time open defecation was also there. It was rampant, So I was thinking that why this? I mean, is it just to increase the number of toilets in a village and nothing changes? Mostly people use them, the new toilets built, but many didn't use also. The liberty of, open defecation was there also. So I was, this question was haunting me. I was thinking that if this happens, then what health impact do you get it? And there was, of course, rampant diarrhea, cholera, and other things. They used to be there. So from that, we, in my recommendation, one of the recommendations, I gave that the poverty in Bangladesh was not same, but how come, you gave the same subsidy? So one recommendation was that to conduct a participatory poverty assessment and design a differential subsidy. I mean, more poverty, more poor, so give more subsidy, less. So that was the idea. And then they came back to me, the Water Aid, and they said, could you help? And I said, okay. So after some time, we went there, but then the question was, hovering in my mind, and I thought that, why do the people defecate in the open in the first place? Because the traditional understanding of water and sanitation sector by the professionals was that people are poor, that's why they defecate in the open. They don't have the means to construct a toilet. So that's the, underlying mindset.
Yeah.
But then I thought, is that a correct mindset? Because there were toilets also, So then we thought, okay, let's go back to the people and learn from them that why do they defecate in the open? Is it by choice, or is it, there is no means? What is it? Then we went there. And then we used some participatory tools, to mapping and who defecates where and all sorts of things, but precisely to understand. It was totally a learning exercise. And in that village, somewhere, it's called the village called Mosmoil in Rajshahi district in the north of Bangladesh. I remember that day, and I told all my team members, don't talk about toilet, don't prescribe anything, don't suggest, just learn. Totally, we said we came here to learn. That's how it began. People started gathering, huge map. People said that they put in colors and all that, where they defecate and etc. We walked around the village, we saw piles of, human excreta flowing into the water body, people are taking bath and, washing clothes and everything going on. So when people walked along with us, the realization started building up, and then they realized that how many quintals of human excreta and shit is being generated. It was building up. The environment became heavy, and then women started spitting and, some vomiting and even, closing their nose and everything. Covering their nose and mouth and all that, I thought, what's going on? You could see that, from the discussion by the people, the analysis by the people, and then they were explaining what's going on, because we derolled ourselves as a learner, and their role was the trainer or teacher explaining about their village, where we are strangers. It built up, and people then, they said, sir, give us some money, we will build toilets. Then we said, no, we are not here to ask you to, we reminded, our role is just a learner. And then they said, then why did you ask us to do this? We said, is that, somebody said, no, it's not your problem, but from teaching you, we have been realizing that it's a terrible thing, we have been doing it, People came again and said, please do something about it. We don't want to live in this environment, We said, look, we are not. We told them the truth, we are just giving as a learning exercise. Then one guy stood up and he said, look, sir, many NGOs, the governments, NGOs mainly, they give us money, subsidy, and you are saying you don't give us money and you come here to learn. But look, if you really cannot give us any subsidy, if you talk about subsidy, we are all poor. I said, I understand that. It's a poor area, But this analysis that we have done now, we cannot survive, we cannot live like a human being for a single day. I said, yeah. Now what do you do? But whatever you do, you continue like this, or you do something, it's up to you. But we have learned that you understand so much about the situation. Then everybody said, we are not going to live like this for a single day even. We are going to do on our own. And we don't have so much of money. Whatever we can, we will do that. I said, fair enough. And they said, in 2 months' time, we are going to stop open defecation. I said, if you did that, I also give you a word. I'll come back with the newspaper and the television and tell the whole Bangladesh, that this is one village who didn't wait for any outside help and did it on their own and stopped open defecation. And the rest is the history. At least 15, 20 countries from all over the world visited that place, and that was the birth of the CLTS. But I saw the tip of the iceberg when this man said that if you talk about subsidy, we are all poor. But we cannot live like this as a human being for a single day.
So that was the flash of inspiration.
That was the flash of the inspiration.
Yeah.
He immediately referred it to subsidy. That we know it, we have been waiting for some money. But if there is no money, we are not going to wait. But it's not that they didn't know the situation, they knew it. But, collectively, together, they didn't do that analysis before. Individually, they knew, they cover your nose and walk some path, which is smelly and everything.
Do you think you were just lucky? There are so many people at the time working in sanitation, right? Why didn't this happen in other places? Other people see this insight.
Dale, that's a very, very interesting question that you have asked. That it was, as you know, that I come from the background of agriculture and livestock production systems, and for me it was a new area, sanitation, water and sanitation, and all that. But when I was leading that evaluation study, mainly because I used to do quite a bit of participatory analysis, poverty assessment, impact assessment, so they brought me to check a participatory impact assessment. But then it was my introduction to this over the world of water and sanitation. Coming back to the question that you raised, that of course they were specialists of water and sanitation, but why they did not think about it? And I, being a professional coming from a different discipline, my angle, the perception of looking at this was different. It's more from a common person's perspective. But when I asked this question, I thought why they didn't think about it. I think they all agreed to the underlining, assumption that people are poor. They need money and support to build toilet. So one was, nobody challenged that toilet is a solution. And that's why they have to be given toilets. That used to be the thing, and it's still, hugely changed, but, still to some extent it is there. The toilet, they don't have money, give them toilet. And they don't understand all this, teach them hygiene education. They cannot build a toilet, give them prescribe technology. So everybody agreed to that. Nobody challenged that one. But then when we went as a learning exercise, you went to the village and we tried to understand why do the people do it. Then I realized, no, nobody spoke about toilet. They all started saying that we must stop open defecation. They were referring to a behavior change question. And that too, not individual behavior, collective behavior change. We must not allow anyone to do this. So then it triggered in my mind, all of those things. One, collective behavior change. Two, not an individual acquisition of a toilet by some and others practicing of it. It was not that. The public good. Nobody defecates in the open.